We're at the 2011 Food Safety Summit in Washington, D.C. I'm joined by Dr. John Spink, who is the Associate Director for the Anti-Counterfeiting and Product Protection Program, short name A-CAPPP, at Michigan State University. Today we're going to be discussing a little bit about food fraud. Let me know when you're ready. Good. Okay. So John, food fraud is frequently cited as an ancient crime. It's been, tracked back to, Roman times with fraudulent labels being placed on products. But it seems like it's only been in more recent years that this has been in the news and like a huge concern for industry. Is that really the case, or?
I think that the amount of fraud going on, say, per capita is probably the same all the way back to, like you said, to Roman times. What we've got now, though, is we've got manufacturers that are producing so much more product at one facility, and product that's being distributed very widely around the world. So in the past, where one incident may have only affected people in a part of a town, now some of that product can be around the world, like melamine and pet food, and really affect global markets very quickly.
Okay, so really it's just, more is going further, and people are hearing about it more for that reason. And then also melamine was such a huge safety scare, and that was something else.
Another aspect of it is that we're a lot more aware of food safety incidents, and we have a lot better capabilities to figure out exactly what's making people sick. There's still estimated that, say, 1 in 40 people that has a foodborne illness reports it. So number one, if you get sick, report it to your local county boards of health or state boards of health. It's very important. Then we can track these problems more. So we've got better technology, so we're able to then identify, say, DNA marking or DNA analysis of certain types of E. coli, and we're able to really establish the true source of that outbreak.
Yeah, so we need the information. If you're going to track the source, you need the data, right?
A key with finding the source of any foodborne illness is identifying first, what made someone sick. And for us to find clusters of outbreaks or anything, we need to have more data. So when people do get sick, they need to report it. And then we'll have a lot more information about where that product came from.
Mm-hmm. And I have heard people say before that detection methods are driving a lot of the innovation as well.
There's a tremendous amount of increased risk over the last several years because our traceability systems are getting to be very precise and complex, as well as our ability to test a product or a bad bug and then use scientific methods to define precisely that it is the same bad bug that was found in a manufacturing facility or in a distributor's facility. So we're able to find the smoking gun more often and with a lot more accuracy.
Okay, yeah, DNA methods play a lot into that, right? Like being able to specify exactly what strain of listeria was in this or that.
What we're able to do now, where we weren't able to before, was to really have just better scientific methods to identify the problem that someone is having from a public health standpoint. From a medical standpoint, we can identify that, and that's something we saw with melamine. So we were able to get in and we had more affordable, really high-tech tests, so we're able to identify the response. From a food fraud standpoint, it's very unique because the bad guys are not trying to hurt anybody. And so we really find the product, usually we find food safety issues when a human or a pet gets sick. And if it's economic motivation and the additive or if it's product that's diluted doesn't make a human sick, we don't have the natural triggers that we usually have.
Yeah, I mean, I've heard that it's so hard to figure out where to go in terms of detection technologies and whatnot with food fraud because there's just such a substantial list. Like there's so many permutations to what could be happening to a product.
One thing we've done with food fraud specifically is to try to prevent. We've had to understand the cause, not just the effect. So when melamine got in pet food, or if anthrax is on a product, it becomes adulterated product. And so all the systems are put in place to immediately gather that product and get it out of the system. That's really the cause and effect. That's the reactive approach. And to really look at prevention in food safety, we look at hand washing, sanitizing in plants. But in the case of food fraud, we're dealing with a human fraudster. So it's really more of a crime that's going on. So we need to look at criminology and the behavioral sciences rather than epidemiology and microbiology.
So it's very multidisciplinary. For sure.
What we're doing with food fraud to really look at the core source, to really understand the fraud opportunity in the first place, is we really have to take an extremely interdisciplinary approach, because the bad guys aren't looking to commit a type of fraud or intellectual property crimes. They're looking to make money, and they'll do it with whatever opportunity they have at their fingertips. If they happen to be running a toothpaste plant, then the fraud opportunity would be with toothpaste rather than luxury watches. And so we really look at the fraud opportunities across the board. We dig in with corporations and companies and look at their specific vulnerabilities based on the type of product they have, what's going on in the marketplace, and then different vulnerabilities from within their own system.
Okay, so for an example, say a food processor has a product portfolio that has a lot of, say the value ingredient is protein. Protein was the ingredient of issue in the melamine case. Would that be an indicator for them that they could say, well, this might be a vulnerability if someone wanted to increase the market value or whatever?
Something we're doing from a science-based standpoint, one thing is we want everything to be evidence-based and science-based. So we're trying to do testing and look at the big picture. Something that's going on with U.S. Pharmacopeia, which now runs the Food Chemical Codex, or the National Center for Food Protection and Defense in Minnesota. So we're looking at case studies to first look at examples that we know of food fraud, say back to 2000. So they're kind of modern. But we try to really look at the type of fraud that people are pursuing, and the type of fraud that actually creates a public health threat. And that's real key. First, we have to prioritize public health threats before economic threats. That's the way all agencies, us as citizens, ask our agencies and law enforcement to prioritize that way. So we first look at that. But then the second part is to look at what type of opportunities or triggers are out there. And we need to look at every food fraud incident, the type of fraudster and type of fraud in the very micro sense. We can't at the start look at it population-wise. So we need to dig in and look at those specific types of incidents. So I agree that we look at what are the attributes of a product that lead it to gain a higher price, to be premium. And in many products, it's fat content, protein, and some other type of attribute to it. So then the next step from there is to look at the type of tests that we use, the rapid tests in the field specifically that identify high protein, high fat, or the other type of attribute. And then at that point, that's where the fraudsters look at trying to dupe the system, and that's what we saw with melamine. That's why melamine was the perfect fraud additive to put in, the perfect counterfeit additive, because it precisely mimicked the test attribute that companies were looking at for the rapid testing of protein.
Okay, because melamine is a molecule that has a lot of nitrogen, and to determine the protein content, they use nitrogen.
Exactly.
So that's what was happening.
In many of the rapid tests we use, we don't test for something like actual protein. We test for certain markers that have been found, or certain ratios of different types of components of it that tend to indicate that specific attribute. So the bad guys will look at other ways to put some other types of additives in that will dupe the system to think that it was a high protein product.
It's quite sophisticated. This isn't a small, to know that much about the detection method and to be able to manipulate it, that's pretty sophisticated.
There's a wide range of fraudsters, from people that are very, very small volume to very high volume, and from very low tech to extremely high tech. In some of these cases, we definitely see organized crime involved. They spend millions of dollars in research and technology, hiring PhDs and other types of scientists because they can make billions.
Wow, it sounds quite daunting. It sounds like a daunting problem. There's such a huge scope, but it sounds like you guys are making some good headway, and so, yeah.
We've had tremendous support from industry, from agencies, from other academics, and a real key is us just getting encouragement to keep moving forward on the fraud opportunities, starting to understand it more, and starting to understand how companies fit this into their food protection plans, how it fits into things like the Food Safety Modernization Act and others.
So it's collaborative.
Absolutely, no
Okay.
question.
Okay, great. Thanks very much, John.
Great, thank you.